Remember, the orthopedist in most cases is going to treat based on the x-ray and finding of arthritis. This means most likely that a cortisone shot is soon to follow with other anti-inflammatory drugs. The huge concern I have about this scenario is that if arthritis is assumed to be the cause of the pain, this is not something that can easily be resolved other than by surgery. Most people wouldn't want to get surgery unless the pain is unbearable. So the person most likely will live the rest of their lives on shots and medications. Their functional capacity will be limited, and they think there is nothing else that can be done to improve the quality of their life. Watch how easy it is to confirm or refute the diagnosis. First, have the person with the painful shoulder raise their arm as high as they can. Let's say at best, it is shoulder height. Now I would have the patient lay down on their back and relax their arm while I try to raise the arm and move the shoulder. I might find that I can move the shoulder almost through full range of motion. If arthritis was the cause of shoulder pain, then it wouldn't matter who raised the arm. The height that the shoulder could be raised must be the same, the point at which the arthritic change is preventing the joint from going through any further range of motion. Since I was able to raise the arm to almost full range of motion, this proves that the limitation in range is only when the person actively raises the arm. This tells you that the limitation is not just structural, like with arthritis, but muscular. The muscles responsible for shoulder motion have strained and are not allowing the joint to move through range of motion correctly. A targeted strength training program would allow the patient to achieve full range of motion, full resolution of pain, and a complete return to normal function. Look at the difference in the end results when the proper diagnosis is achieved and the right tissue is addressed. As you have heard, when I have found that the cause of pain is muscular-based, the key to resolving the pain and dysfunction is not simply knowing that the cause of pain is muscular, but knowing which muscles have strained and then performing a targeted strength training program. There is a false sense that all exercise is good. As long as you've been doing something, it must be beneficial. Here are the facts. Doing the right exercises is good. Doing the wrong exercises is bad. And doing the right exercises incorrectly is bad. Aerobic exercises like bicycles and treadmills build muscular endurance, not strength. Muscular endurance is the ability of a muscle to create a set force for a sustained period of time. Muscular strength is the ability of a muscle to perform increasing force for a short period of time. It is muscular strength that is needed to improve function, not endurance. I have treated so many patients who had surgery for a joint like the hip or knee or the back, and then were told that the key after surgery to regaining function and resolving their pain was walking. My point to this is that prior to the surgery, I am confident that the person was walking during their daily activities. If walking is the key, why didn't the walking prior to the surgery resolve the pain? We call this program a prescription because it must be understood that this is not a one-time treatment and your pain is resolved. This is going to take effort and time. The idea that you get out of something what you put into it really is valid in this situation. You will have to work hard to increase the resistance that the muscles work against to get them stronger. The method acts as a guide, but the ultimate responsibility lies with you in resolving your pain. If you are performing the exercises correctly, it should feel like you are working hard, putting effort against the resistance. There are a few misconceptions that I want to clear up about exercise also. For instance, performing the exercises without resistance is good? False. You should perform the exercises every day? False. You need to go to a gym to perform the exercises. False. The only important concept in strengthening to resolve pain is that you must perform the correct exercises with the correct resistances. This doesn't need to occur more than 2 to 3 times a week. The number of exercises to be performed shouldn't be more than about 4 or 5 exercises. So the time it should take to perform an exercise session would be no more than a half hour or so. I think most people can commit to a half hour or so, 2 to 3 times a week, to resolve their pain and return them to full functional capacity. Don't you?
Yes.
Great science works when there is a strong theoretical basis behind it. As you've seen, I've presented scientific, clinical, and theoretical evidence of why the Yass Method is the only true method to identify the cause of your pain. I want everybody to have the opportunity to benefit from the method so that the proper treatment can be performed quickly and effectively, and quality of life can be returned as soon as possible. I want that for you, and I want that for you right now. Let's continue our discussion with a few more techniques that you can use. GAIT analysis, or looking at how somebody walks, is important because there are certain muscles required for normal walking. One of the biggest deviations is so common, especially after hip surgeries. It is when the person side bends to the side they are standing on to place the opposite foot in front of them. It is an indication of weakness of a muscle called the gluteus medius that sits just above the hip joint. It is responsible for keeping your pelvis level when standing on one foot. If it is weak, the opposite side from the side you are standing on will fall towards the ground. This will make you lean to the opposite side you are standing on. If the lean is enough, you will lose your balance. The body compensates by having you lean to the same side as you are standing on to keep you from falling to the other side. This weakness can lead to pain at the lower back, the hip region, the knee, or the ankle. So if this is seen in an evaluation, it is a critical piece of the puzzle as to why pain is being experienced. Signals like side bending when you stand on one leg with walking, combined with pain at the hip region, lower back region, or knee, must be seen as parts of a puzzle in determining the cause of pain. Another technique is postural analysis. Again, posture is based on the pulls of muscles. So if there is bad posture, it represents muscle dysfunction. A typical form of improper posture is forward head and shoulder posture. Typically, there is a muscle imbalance between the chest muscles, front shoulder, and biceps versus the muscles between the shoulder blades, posterior shoulder, and tricep muscles. Correct the imbalance, and the posture can be corrected. So many of you have neck pain or pain between the shoulder blades and present with severe forward shoulder and head posture, but no system other than mine is designed to put 2 and 2 together. Posture must be seen as a symptom, not a cause of pain. Correcting the muscle imbalance that corrects the posture will also correct the pain being admitted by the muscles in the neck and between the shoulder blades. Misdiagnosis is rampant, and people have the right to know how to identify the correct tissue creating the pain so the right treatment can be implemented. My intent is to first teach people about the Yass Method so they can make better decisions about how they want to be treated when it comes to pain. I also want them to know that in most cases, pain can be avoided if the appropriate exercise routine is maintained. Who wouldn't want to do a couple of exercises a couple of days a week to prevent pain from even starting? Now, I want to turn my attention to 5 of the more common diagnoses that people are given regarding their pain and point out how getting the right diagnosis can be the difference between living with dysfunction or improving the quality of life. First, the big one, arthritis of the spine. It is considered to be part of the aging process and a common cause of back pain. I had a patient named Margie. She was 72 when she started with me. She had lower back pain and was told the cause was arthritis. I was able to determine that her pain was not from the arthritis found, but from a muscle imbalance between the front thigh and back thigh muscles, causing an excessive arching of her lower back. She was given a targeted strength training program, and within weeks, the pain was resolved. Margie went on to join the personal training program I had in my office, and for the next 12 years, she worked out 3 times a week diligently. Margie is a great example of what can be done with the right diagnosis and a little hard work. 84 and working out 3 times a week. Not bad, right? Number 2, hip replacements are very common these days, and typically it is for the wrong reasons. A person might get pain at the groin region that leads to an X-ray of the hip and the diagnosis of bone on bone. I had a woman who was scheduled for a total hip replacement based on this very principle. When I evaluated her, she had full range of motion of the hip joint. With bone on bone, there would have to be a major loss of range of motion, and at the end point of the motion, there would be a feeling like a bone was pushing against another bone, stopping the range from continuing. Next, I pressed in the groin region, and the woman went through the roof. The pain was from a muscle called the sartorius. I treated her with targeted strength training, and within just a couple of weeks, the pain was resolved. Number 3, bursitis of the shoulder. When somebody has shoulder pain, it is not uncommon to get the diagnosis of bursitis. Typically, this diagnosis is derived from looking at an X-ray or sometimes simply just without diagnostic testing. The person is given a cortisone shot and then prescribed some anti-inflammatory drugs after the shot. My problem is that in all the cases I have treated where bursitis was the diagnosis, there was no physical evidence that bursitis exists. If bursitis were present, there would be a large indication of fluid at the top of the shoulder. By definition, bursitis is inflammation of a bursa, so the bursa would have to swell. But in all the cases I have seen with this diagnosis, there was no swelling. Also, if bursitis was the cause of pain, then the shoulder joint could not be moved through full range of motion. So be on the lookout for that. The 4th one is a rotator cuff tear of the shoulder. This is a very popular diagnosis for those suffering from shoulder pain, and yet in most cases, there is no evidence that the cause of the pain is from the rotator cuff tear. The reason for the diagnosis is an MRI finding of a rotator cuff tear when pain is experienced at the shoulder region. The classic attempt to correlate pain and an MRI finding. An acute rotator cuff tear is a traumatic event that occurs due to a fall or excessive load put on the shoulder joint. It is something that you would definitely remember. The inability to move the shoulder and pain would not be there immediately before the event and then appear immediately after the event. For most, what is being found is a chronic rotator cuff tear. This occurs over a long period of time and occurs so slowly that a pain signal is never ignited because the body is addressing it as it occurs. The fact that pain in the region causes the MRI to be performed is the only reason that the tear is found. The most common reason for those suffering from shoulder pain is the rotator cuff strain. Knowing the difference between a tear and a strain could be the difference between getting an unnecessary surgery and not. And the last one, number 5, is scoliosis, one of the most common diagnoses I see for back pain. Scoliosis is just an abnormal curvature of the spine. And when there is pain in the area, the scoliosis is diagnosed as the cause of the pain. I have a severe problem with this situation. First of all, the only thing being identified is that the spine is curved, but there is no indication that the ends of the vertebrae are rubbing or compressing one another that would lead to fracturing. There is also no indication, in most cases, that there is compression of the organs that sit in the thoracic or abdominal cavities that would lead to distress of these tissues. This is why I see no evidence that scoliosis is the cause of pain. In fact, I would say that scoliosis is actually a symptom, just like the pain is, of a muscle imbalance between the muscles on one side of the spine and muscles on the other side. I have treated patients with back pain and the diagnosis of scoliosis for years and have been able to resolve their pain fairly quickly. A very common question I get is whether, even after surgery has been performed and the person still has pain, is it too late to employ my method? The answer is no. Another question is whether the pain can be resolved even if the person had pain for years. The answer is yes. One of the best stories I ever experienced was from a guy named Glenn that I never met until the day he bought me a gift to thank me for saving his life. He had tried pretty much everything to resolve his back pain and was ready to give up. He followed my advice, the Yass Method, just like what's in the program materials that go with this show. Within 3 months, his pain was resolved, all without ever setting one foot in my office and without ever talking to or meeting me. This is one of the best examples of how the method works, even without me implementing it. I hope you are ready to give it a try. So far, I've talked a lot about how to identify the cause of your pain. Let's say that you found that the tissue responsible for the pain is muscle. I stated that the targeted strength training program is necessary to eliminate the strength deficits. Enough with the talk. Now it's time to strengthen those muscles. The best part about this program is all you need is a resistance band. Gym equipment is not a requirement. I created a program so it could be implemented in your home, wherever you are, anywhere. This is the best part of the whole system. All you need is just a simple resistance band. The Yass Method gives you the ability to treat chronic pain and not be a burden on your children or the healthcare establishment as you age. Don't become another one of those people I have seen who start having pain or weakness that leads to a cane, and then a walker, and then a wheelchair, and then dependence on another. Don't end up like so many who get multiple surgeries and are told each is a completely new incident unrelated to the prior surgery. The multiple surgeries people are having are the result of a lack of understanding that strength is the only thing that will allow for full weight bearing through both legs, causing forces of the body to run correctly through the joints so nothing breaks down and emits pain. This is a method designed to successfully identify the cause of your pain, not simply to treat the symptom. You are living longer and want to remain independent. I have treated enough people to see how difficult it is when a child lives in another state and has to wonder about whether their parent might fall. You can prevent this scenario from happening. You can be a participant in your grandchildren's lives and not just sit at home and wait for them to visit. You could do more and be happier if you are pain-free and strong enough to perform all the activities you desire. Take a walk with your friends. Take your wife, your husband, or your significant other out to dinner and a movie. Take a vacation and enjoy the sights without the fear of pain or dysfunction. A better, pain-free life is here for you. The power of the Yass Method is your answer. I now want to discuss the 3 exercises I think are most capable of maintaining maximal function and independence. These exercises incorporate a large number of muscles in the arms and legs, so you can strengthen a lot of muscles with just a few exercises. In the legs, the quads or front thigh muscles are the muscles most associated with functional activities. That is why squats are the first exercise. The good part about squats is that they don't just strengthen the quads, they present the proper form for performing many activities like standing up from a chair, walking, stair climbing, or bending down to pick something up. Squats are great for strengthening the quads, but strengthening them more than the hamstrings or posterior thigh muscles will lead to the quad shortening and possibly creating back or knee pain. That is why the second exercise to perform is straight leg deadlifts. This exercise strengthens the hamstrings and glutes. These muscles are responsible for the activities that the quads are, but to a lesser extent. When it comes to the arms, the best exercise to perform is military press. This is because, as a general rule, the muscles responsible for pulling objects toward us are generally strong. It is the muscles responsible for pushing away from us or lifting over shoulder height that are weaker. Military press actually strengthens all these muscles. There you have my choices for the best 3 exercises to sustain function and retain independence. I want you to have an active life, whether you're playing golf or tennis, gardening, dancing, or just enjoying your grandkids, all without pain. It is possible when you follow the Yass Method. Here's to living a healthy, happy, and most importantly, pain-free life. Thank you.